Hi everyone! This video was meant to create awareness of amphetamine drug use in sport. Statistics reported annually by WADA laboratories reveal that the annual numbers of adverse analytical findings for stimulant is second only to anabolic agents. Amphetamine was first synthesized in 1887. It was originally prescribed for the treatment of nasal congestions. In 1937, amphetamine was used to treat the neurological conditions narcolepsy, and its use in the treatment of depression, anxiety, and hyperactivity in children followed from this. Amphetamine was used widely during the Second World War to reduce fatigue and increase alertness. Several structurally related drugs are known as amphetamines and include dextroamphetamine, fenfluramines, methamphetamines, methylphenidates, phenmetrazines, and phentermine. Amphetamines are readily absorbed, mainly from the small intestines, and peak plasma concentrations occurs 1 to 2 hours following administrations. Absorption is usually complete in 2.5 to 4 hours and is accelerated by food intake.
These effects include an increase in physical energy, mental aptitude, talkativeness, regularness, excitement, and good humor. Subjects taken amphetamine also report that they feel confident, efficient, and ambitious, and their food intake is reduced. Many adults report that they feel most aggressive when taking amphetamines and are unlikely to report or complain of injuries. Amphetamines could be abused for different reasons by different addicts. Thus, baseball and football players may use them to increase alertness and concentration, whereas runner or swimmer use them to increase energy and endurance. This may be found by the reference Smith and Perry 1992. The effect of amphetamine on the psychological stage of athletes might be a result of the athlete expecting to perform better and be more alert.
Peripheral side effects of amphetamines include sweating, palpitations, dilatation of the pupil, and rapid breathing. Hypertension, tachycardia, tremors, muscle and joint pain. Amphetamines also produce a number of centrally mediated side effects, including anxiety, indifference, slowness in reasoning, irresponsible behavior, irritability, restlessness, and insomnia. There is much evidence to show that amphetamines induce drug dependence, and the amphetamine-dependent person may become psychotic, aggressive, and antisocial. While withdrawal of amphetamines is associated with mental and physical depression, amphetamines cause a redistribution of blood flow away from the skin, thus limiting the cooling of the blood. As a result, two cyclists, Renat Jensen and Tommy Simpson, who had both been taking amphetamine, died of heat stroke and cardiac arrest respectively during grueling road races.
The federal penalties range from up to 1 year in prison and a $1,000 fine for a first offense to 3 years in prison and a minimum fine of $5,000 for a third offense. All of the penalties can be increased if an intent to distribute can be proven. Sport organization can also punish its member for possession. In the NFL, players are tested yearly for steroids and amphetamines. Violators get a mandatory 4-game suspension for a first offense, a 6-game suspension for the second, and a full season for the third. Baseball suspends players 50 games for a first offense and 100 games for a second, even if the player is in the minors. If an Olympic athlete tests positive for any of the organization, hundreds of prohibited anabolic steroids, growth hormones, or narcotics, the athlete is removed from the competition for at least 2 years and stripped of any medals that were recently awarded. A second offense could lead to a lifelong ban. Although the clinical uses for stimulants are limited, it must be noted that they are used by athletes for the treatment of valid medical conditions may be subject to therapeutic use exemption regulations.
Stimulants are a broad class of drugs, many of which are abused recreationally. Stimulants are one of the classes of drugs that appear most frequently on WADA statistics on AAFs. The potential benefit of many stimulants as performance-enhancing agents is equivocal. The WADA regulations for stimulants, including therapeutic use exemptions, are complex.
Thank you for watching this video. Play true, play safe.